Hello everyone. For most of us, when we begin our practice, the majority of the patients that we see are related to acutes, right? And a large chunk of our acute cases come from colds, coughs, fevers, hmm, allergic conditions, asthma. These are the cases which form the bread and butter of our practice. Majority of our cases belong to two systems. One is respiratory and second is GIT, especially when we are in the beginning phases of our practice and when we are seeing simple cases. And if we master these, then our practice is like set. So, keeping this in mind, that for a large part of our practice to be very good and to have very good consistent results in colds, coughs, and other respiratory diseases, we have come up with this respiratory course where where we are going to have a comprehensive understanding of the whole respiratory disease. So starting from the relevance of knowing which location is affected exactly in the respiratory system, to prescribe remedies, to importance of clinical, to various keynote remedies, and how to manage chronic conditions in respiratory diseases like bronchial asthma or COPDs. We have come with this comprehensive uh, course on respiratory disorders, right? So, for example, if a patient says that I eat anything since my throat infection, if I eat anything, I have difficulty in swallowing, then just mere examining and seeing whether it is right tonsil or left tonsil. It is If it is right, Merck IF. If it is left, Merck IR. If there are pus pockets, then you think of Hepar self or you think of Baraita calf. These tips really just by just mere examination or just by looking at patients, how we can come to remedies, how clinical understanding is important, how simply listening to the cough of the patient, how to recognize what exactly is affected. If the patient has it's more throat and barking kind of cough, then we think of something over here. But if the patient coughs from deep inside, I'm not able to cough, sorry. So if the patient coughs from deep inside, then you will exactly know that this is a COPD cough. How to identify these coughs, how to identify what is affected and where the characteristic is, and how to find characteristic symptoms. This will firstly give you very good immediate prescription ability to prescribe correct remedies, but it will also give very consistent, accurate results in your practice. And based on this, we will also know what kind of investigations to do, what kind of auxiliary advice to give, how to improve the overall health of the patient. With this in mind and considering all these aspects of respiratory disease, we have come up with this course which begins from 25th of April 2022, from Monday to Thursday for 4 weeks, 16 exhaustive sessions on respiratory disorders from very senior speakers like Dr. Farooq Master, Dr. Sujit Chatterjee, to popular speakers like Goran and many other speakers. We all will be there teaching you everything about respiratory diseases. We welcome you all and hope to see you soon. Bye bye.